Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth. So I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello and welcome to Health and Harmony Beyond the Teeth. I'm your host, Dr. Hal Stewart, owner, CEO, and founder of the Stewart Center for Optimal Health. I'm a trained dentist, but many years ago, I realized that health is much more than just a healthy mouth, although that's where health starts. But I started looking into airway, sleep, how I can make my patients healthier by helping them breathe better, sleep better, and just overall thrive by having and developing beautiful faces. But this body of ours is all tied together. It's not just a heart or lungs or legs or arms or a brain. Everything's tied together and everything is dependent upon the rest of the body working well. And, you know, we've all known people that were, quote, healthy as a horse, and they dropped dead of a heart attack. Well, my contention with that is that they're not healthy. They may appear healthy. They may run a marathon. They may exercise every day. They may eat really healthy. There are many, many reasons that people might have an issue with cardiovascular disease or heart attacks. And that's what the focus today is on. I'm very pleased to welcome our guest, Dr. Gina Pritchard. Dr. Gina Pritchard has a practice, the Prevent Clinic in Frisco, Texas, and she's here with us today. So, Dr. Pritchard, welcome.
Thank you so much.
Yeah.
I'm thrilled to be here.
Well, it's great to have you here.
Thank
Our
you.
history goes back about 8 or 9 years when I went to a course on how to prevent heart attacks, guaranteed by Dr. Brad Bale and Amy Doneen. Dr. Bale is a family practitioner. Amy is a nurse practitioner, like Dr. Pritchard. And it was fascinating. I did a two-day preceptorship course with them, and there was a lot of cardiologists there and a lot of nurses and physicians. And anyway, what we know is that heart attacks can be prevented. And it's not just one simple thing like, well, exercise more or eat better. Dr. Pritchard is here to share with us her knowledge, and we're just going to kind of do an overview and touch on this subject. We will have her back to delve more into specifics. But before we do that, Dr. Pritchard, tell us a little bit of your background and how you got your training and how you came to this point in your life where you have your own clinic helping people.
Thank you so much. Yes, so I graduated from nursing school in the late, 1980s. Anyway, I went through the critical care internship at Baylor. Remember when we used to call it Big Baylor downtown Dallas?
Oh yeah,
Baylor
I was there at
University
dental
Medical
school.
Center. Yeah, there you go. And so I went through that critical care internship, and I was so excited because at the time, coronary stents, which perhaps people that are listening have heard of, stenting of the coronary arteries when someone has a heart attack or has a blockage in the artery of the heart, leading to a heart attack, such as we see in the example here, a stent can be put in. And at the time, they were investigational, meaning you had to sign up for a protocol and only a few people could get stents. And I'm like, yay, this is going to save a lot of lives, and I'm so excited to be on the forefront of this. And what we now know is that stents are absolutely wonderful. Fast forward to today when, we put stents in all day, every day. And in the throes of a heart attack, if someone is minutes away from dying, you need a great team at the hospital. You need to get there quickly, and you need a stent put in. You need clot busters, that kind of thing. But back to the early days when we thought this was going to save the lives, and then heart attacks would not be as common. And we had great medicine, so we were going to keep people from, even going to the point of having a heart attack. what I began to realize after working in the critical care unit, after working in the ER, in the bypass suite, in the cardiac catheterization laboratory where these stents are put in, after years and years of that, I realized that once someone came in and had a heart attack or had a stent put in, or we identified that they had vascular disease or atherosclerosis, it set them down a path of a second heart attack and a third heart attack and maybe a stroke in the future, or the need for multiple procedures. It impacted their life for the rest of their life, despite our efforts, despite our great technology, our great medications. And so I remember one day, it was about 2005, when we were in the break room at one of these hospitals. At the time, we started opening up cath labs in the rural area too. So I started traveling to like southern Oklahoma and the outskirts of the Metroplex to help bring stenting, if you will, this life-saving procedure to the surrounding areas where it wasn't available. So we were in the break room that day, and we had put the 8th stent in a gentleman. And these days,
same patient?
In the same patient.
Wow.
Number 8, this patient had been back that
Over
many
a period
times.
of several years.
Yes.
Wow.
And so we were saying, how many stents are we going to put in somebody? Is there a limit to the number of stents you can put in somebody?
Yeah.
Are we going to put stents in the entire, what's called the coronary tree, this blood vessel supply to the entire heart? Will we stent it just from the top to the bottom? Will that work? So this was the conversation. That same day, a very significant thing happened in that I was called to the emergency room. Sometimes if the cardiologist was tied up in the cath lab putting in a stent, they would send the nurse practitioner, which I was working for the cardiology group at the time, to the emergency room to get things started, to see if this person is having a heart attack, what do we need to do. So I was called to the emergency room to see a 45-year-old gentleman that came in with the worst possible presentation of a heart attack, sudden cardiac death, which for the listeners, the worst way to find out that you have vascular disease or that you have coronary artery disease is to have what's called sudden cardiac death. It's from usually a blockage that leads to a rhythm problem. That you're fine, perhaps checking out at the grocery store 1 minute, and then you're calling, hopefully someone's around calling for the ambulance and doing resuscitation measures on you. So anyway, I go to the emergency room to meet this patient coming in with sudden cardiac death. And of course, they were reviving him, and we were determining next steps. And it dawned on me that this gentleman, while we'd had people come in their 40s before, it's terribly sad that it's occurring occasionally in the 20s, for sure in the 30s, and more frequently for people in their 40s and beyond. But anyway, I realized this was the son of both of his parents were patients of mine. I'd seen in the clinic regularly. Wow. They were one of these people who had been coming in and having multiple procedures, and we would adjust their medicines and stuff. And it just stopped me in my tracks. And I thought about all of the people that we had sent home from the hospital after their procedure and said, we fixed that one area of blockage. We put a stent in. And the rest of your arteries look like the arteries of a 20-year-old. You'll be fine. And yet they were back the next year or the next year. And I'm like, we are missing something. Yeah. That's not accurate information because of what I'm seeing play out before me. So I became obsessed with trying to find out what is everyone else in the world doing to prevent heart attacks and strokes from occurring in the first place, or if they do occur, what to keep that from happening again and again. And so then we met as I was, learning about the Bell-Donine method and becoming more and more expert, if you will, at providing this life-saving method, this plan of treatment that we'll talk about more in a minute.
So Bell and Donine have a really good slide. Did you bring that one with you at the tennis court?
I don't think I had the tennis court.
So they show a tennis court, or maybe two, is it?
Yeah. Oh,
and if you laid out all of the blood vessels in arteries in the body, and you laid them out flat and measured their surface area, it's the size of
actually, and a lot of people, 5 tennis courts.
2 to 5 tennis courts. That's
miles of blood.
That's a lot of blood vessels. And the analogy that I've always thought of is like if you had this long pipe running from Alaska down to, the south part of Texas, and you had a clog in it, and the pipe burst, and you go fix that one spot, that's a stent.
Yes.
But if you don't take care of the reason it clogged in the first place, it's not necessarily going to clog there again. Now it's going to clog up somewhere else, and it's going to burst again. another stent.
Yes.
And so we think of this in the body, we've got literally miles and miles and miles of arteries.
Yes.
And it's not just occurring in one spot. These can pop up anywhere. So I know that there's 5 predispositions or 5 causes of heart attacks, strokes, aneurysms, and things like that. Can you talk a little bit about those?
Yes, and if I could add to what you just said before we move on to the 5, Derek, would you show that slide one more time that shows the stent? The reason I want to bring this back up is because on one side of the screen, we have a cross section of an artery. So the arteries that you were just talking about, that we have miles and miles.
That's an actual artery that's been dissected out of a human being.
Exactly.
Yeah, okay.
So they are, of course, long pipes, flexible, like noodles. Mm-hmm. Some are the size of a human hair, and then some are larger, like, the size of, let's see, what would be larger than an ink pen? Like
maybe a big straw?
Yeah, something like that. Mm-hmm. And so this wide range of blood vessels in our arteries in our body. Blood vessels are arteries and veins. Arteries are the ones that give the life-saving oxygen and nourishment to every cell in our body, every organ in our body. And so when we put a stent in, that one coronary artery, as you were describing earlier, much like shown in the slide, that's probably a 1/2 inch of this miles and miles of blood vessels. If that, maybe a 1/4 of an inch, sometimes an inch, depending on how much of the area is involved. So that's an actual example on the other side of the screen of a coronary artery that you can see the metal in there. That's a little metal scaffolding that was placed in the artery to sort of just press the walls, the plaque into the walls so that blood flow is maintained. Mm-hmm. So as you can see there on the artery, there's a depiction of plaque formation in the wall of the artery. But that pipe area, which we call the lumen, is wide open. If you looked at that on a heart catheterization or did a stress test, it would look fine. So when we sent people home saying your arteries, the rest of your arteries look like the arteries of a 20-year-old, we were looking at something like that. But what we now know is, yes, maybe it looks fine today, but that little area of plaque can be soft and can look like a blister or like a pimple if you analyze it closely, and that can rupture. That's why someone can be fine checking out at the store today and then a moment later be laying on the ground, because it can rupture like a pimple, and then the body sends in blood clotting mechanisms. And that's why you have to get to the hospital quickly. So I just wanted to pause on that and elaborate a little bit, because your point is so good in that all we did was put a stent in a little 1/2 inch area and leave miles and miles and miles of blood vessels unprotected.
And it's literally impossible, nor why would we put stent every vessel in the body.
Yes.
We just can't do that.
No.
But there's a way to live and lifestyle that will prevent that from happening.
Yes.
But there's different things that, is there a genetic predisposition? I know that was one of the 5 determinants. So we have genetic predisposition, oral systemic, inflammation,
insulin resistance,
and the what is
like
it?
toxicity, like heavy metals, endotoxins.
Toxicity, So let's talk a little bit. We're going to cover all 5 of these briefly. Then we're going to have you back and break these down some in future podcasts. But let's talk a little bit about genetic predisposition. I know that I have a patient that of this patient that has every male in his family has died or had a heart attack in their 50s, and he is doing everything he can to prevent that. He's well into his 60s now with no issues. He's doing the right things, but there is a genetic predisposition, correct?
Yes, there definitely is. And so a lot of people say, okay, well, I had a family history of heart disease, so I don't want to know my genetics because it's going to happen to me. The thing about that is inaccurate or is not a very smart way to think about your life is that we now know that you can change the way that your genetics are exposed in your life. This concept of epigenetics, of changing your environment, changing the way you treat your body, the way you treat every cell in your body, can keep those genetics that maybe have an unfavorable potential from being expressed unfavorably. So maybe it happened to your father or your grandfather, your mother, your grandmother, your aunt, your uncle, but it doesn't have to happen to you, even if you have some genetics that would suggest otherwise. An example of that.
So you can really change how the gene expresses itself.
Yes, absolutely. You can.
Good or negative or good.
Yeah, or support those ones that are in your favor as well.
Right.
Yeah. So it's important to get a panel to look at the genetics to see if you are have the potential to be headed towards, let's say, Alzheimer's disease or dementia or heart attack, stroke, etc. There are genes that tell us that we have a greater likelihood of having heart arrhythmias, and we can take early measures to make sure that you're protected from that.
So a blood panel, a blood study.
Yes, and you can do it with saliva or blood.
That. Okay, okay.
Either one.
Yeah, so these things, we have so much knowledge now and technology that we can, a lot of these things are very easy to identify and treat.
Absolutely.
And then the oral systemic number 2 that we saw. Tell us a little bit about that.
Yeah, so I almost hate, you were talking earlier about, I forget how you said it, whole body health or something like that. I almost hate that we say oral systemic when, hello, it's systemic, right? But it's like this professional organization was organized, right? The American Academy of Oral Systemic Health to try to say, we need a dental team and we need your cardiology team or your neurology team, your primary care provider at the same table collaborating on your care, because there are certain things that are at the highest risk, put you at the highest risk for heart attack and stroke and dementia that are occurring in the mouth, that are occurring in the nose, in the airway. And so even when I started saying I'm moving out of the hospital and I'm going to try to keep people out of the hospital, I did not appreciate the intensity in which that's true in the population. Now I say, of the two most common oral systemic related risk factors that I see, either someone is not oxygenating well, night or day, or has an airway problem, in other words. We used to say sleep apnea, and of course you can speak to that more eloquently than I, but it's a continuum, right? There's very many factors at play. It's not just you have sleep apnea or you don't, move on. It's very complex. But those type of issues, or periodontal disease, or even if clinically the person doesn't look like they have periodontal disease, but some of these bacteria are residing in the mouth that put you at high risk for heart attack and stroke, 9 out of 10, if not higher than that, almost all of my patients have one or both of those. And so it's like I start there. Yeah. In the past, when practicing in a traditional cardiology clinic, people can probably relate, like even at the primary care doctor, we look at cholesterol, maybe weight, blood pressure, smoking, maybe exercise. So if you get a good, thorough evaluation, maybe 5 things are looked at, maybe a fasting blood sugar. But as we mentioned earlier, there's 30 or 40, maybe even 50 risk factors that really need to be evaluated. So to get a comprehensive understanding of, are you headed for heart attack or stroke or dementia, you really need to get a more complete blood panel, more complete urine panel, the saliva testing like we have been talking about to look for the bacteria, a assessment at a dental clinic such as yours that looks at this from a comprehensive standpoint. Yeah. So at least 50%, let me back up, we have definitive evidence to support the fact that 40% of heart attacks, particularly in young people, occur from these bacteria in the mouth. And 50% of people that come in with heart attack strokes, and that number or higher, have either the bacterial pathogens or an airway-related problem. So to say oral systemic, it's like we almost need to start there. Like I do care if your blood pressure is high. I do care if you have high cholesterol. But if you're not breathing at night, or if you have some bacteria that maybe nobody's tested for or haven't had a thorough oral health evaluation, you're at the highest risk. And that's why someone can be the healthiest person on the block. Like you talked about earlier, maybe they work out, maybe they look pretty good in the mirror, or they, whatever our measures are for healthy. I can lift so many pounds of, weights at the gym, or I can run so far, or whatever your metrics are isn't adequate unless you've had a thorough evaluation in both the dental office and then a prevention-focused medical office.
Well, your point is great, and it's well taken, because I had I work out a lot, and I work out at a private gym. I also work out at LA Fitness, and in our neighborhood we have a gym too. But I had a trainer as a patient about 6 or 8 years ago, and this guy was built really well. He, muscular, looked very fit. His oral health was horrible, and I told him, I said, I know you train. He trains for bodybuilding contests. He runs. He does cardio. And I told him, I said, you're not healthy. You're not healthy. Well, I saw him a couple of years later. He came in, and he's on high blood pressure medication, and he's on statins because he had I don't know if it was a full blown heart attack, but it was he had a ischemia.
Yeah.
He had an episode.
Okay. Yeah.
And he became a believer really quick.
Yeah.
But the mouth is a warm, moist, dark environment. And if you feed it the wrong things, a lot of people, eat a lot of carbohydrates, processed food that stays in their mouth, becomes very acidic. A lot of really, really bad bacteria can start growing in there. And that bacteria is not isolated. There's a highway of blood vessels from the mouth straight down to the heart.
Yes.
And where do those bacteria go? They get into the blood and they go into the heart, and then from there they go into the other arteries and they start developing or forming plaque. The same kind of plaque that you have in your mouth if you don't brush your teeth. You get that filmy white buildup. Those same bacteria are found in people that are having heart attacks.
Exactly. There's
creating
been more
that
than
same
one
plaque
study.
inside your coronary vessels.
Yes,
Yeah.
that's right. And they've identified that they're at the site of a heart attack inside that artery wall, like the picture we saw earlier. Those pathogens are active, like it's an inflamed artery wall. Think of it like a sore on the wall of your artery.
Right.
And it's the bacteria that have started in the mouth and gotten into the bloodstream there, which, as you said, so easy to do. The mouth
So an aneurysm, an aneurysm is just kind of an eruption, right?
Yes.
Something like that happening?
It is, right. Usually an aneurysm is a dilatation, and it starts with an unhealthy artery wall as well. But if it's not identified early, then it can absolutely explode, for lack of a better word. It can erupt, and rather than, your body does send in the blood clotting mechanisms, but if it happens in the aorta, for example, that's definitely an immediate life-threatening emergency. And so you can do, simple ultrasounds to assess your aorta and to look for areas of dilatation to see if there's areas of disease at the early stage before it becomes an aneurysm or before it comes even anywhere near an aneurysm.
Yeah.
So these things such as what you were trying to tell your trainer and what we try to tell people every day that we see in our offices, it doesn't have to be a mystery. People think that what we do in trying to save people's lives is somewhat nebulous until they have an event like you talked about, and then they're like, what were you saying?
Right, yeah.
Could I have known? So we're trying to say to everyone that is out there that does feel fine, whether you have a family history or not or whatever, there's a thorough prevention-focused workup in the dental office and in your primary care or your cardiovascular prevention-focused office is key.
Yeah.
You can get you a few additional tests and know where you stand with your arterial health, whether you're headed for aneurysm or headed for rhythm problems or headed for a heart attack or stroke, and truly turn the car around by just chipping away at these things one at a time first,
And the usually the first symptom of a cardiovascular disease is a heart attack or a stroke. So
Right.
those are not good symptoms to have.
No.
It's not, your eye doesn't twitch for 6 months before you have a heart attack. You have a heart attack out of the blue. You might be with your family at Disney World, or you might be at a birthday party, or you might be sleeping at night and you have sleep apnea and you already have a compromised heart. So that's what Gina, Dr. Pritchard, is devoted her life to helping patients not ever have to go through that, not ever have to see a loved one go through that.
Yeah.
So we're running out of time on this podcast, but for the last few minutes here, tell our audience what you do, just kind of in a nutshell. We'll have you back so you can get more specific on this, but if I'm, I'm a 59-year-old male, I take, relatively good care of myself, but I'm like, you know what? I don't ever want to be one of those numbers. So I'm going to come to you and kind of walk me through that process of is there any patients out there that would be interested in doing this?
Yes. Okay. So someone such as yourself or anyone interested in this type of life-saving care calls up and we get, of course, your history, because sometimes there's some clues. Things can be hidden in your history in terms of, even a chest x-ray could show calcium in an artery. Or a mammogram. Sometimes we'll see calcification in the mammary artery. So anyway, we want to get a history, but most importantly, you come in and we collect blood, urine, and saliva, and we do a few screening tests. The blood, urine, and saliva is probably more lab data on yourself than you've ever had done before. An in-depth look at your genetics. We look at all of these root causes that we were talking about earlier, so 30 to 50 things. And if you don't have a dentist on the scene, such as yourself, that appreciates the oral systemic connection, then we get you connected with one, because we have to have at least a home sleep study, that CT scan like you do in your office to evaluate the airway, and we have to do that bacterial pathogen test, which is the saliva. So either I get started with the bacterial pathogen test while we're trying to locate a dentist, because I have patients all over the United States. So sometimes it can be a challenge to try to find a colleague to work with, but we track them down. Anyway, so I get started with the bacterial pathogens. So you get blood, urine, saliva, and then we need to understand, just as we were speaking about earlier, is your heart healthy? Is your brain healthy? And are your blood vessels healthy? And so depending on what you've had done to date, it may just be an ultrasound to look at the artery in your neck, the carotid arteries. We can get a lot of good understanding of your overall arterial health by looking there. We sometimes need an echocardiogram, an ultrasound of the heart, to help us understand if your heart muscle is strong or if there's any problem with the heart valves, anything structurally going on. And occasionally we need an ultrasound elsewhere, or something called a coronary artery calcium score, which is another CT that looks for calcification in the heart arteries to help us understand if there's blockage there. And then the list goes on and on. So it's kind of a customized approach at that point. But the blood, urine, saliva, ultrasounds, cone beam CT like you do in your office, this risk factor assessment, if you will. It's kind of a comprehensive assessment. So we send the tests off. And while we send the tests off, we start collecting more data on you. We want a food journal. We want your exercise log. We want to know, how do you feel in the morning? What's your perception of your sleep? Do you feel like you're ready to go during the morning, or you wake up and say, I can't face another day, I'm so exhausted? So a lot of things about your lifestyle at home, we start collecting data on you while we're waiting for those tests to come back. And then when all the tests come back, we either have one or two, or sometimes we spread it out over a few week period of maybe 4 little 1-hour visits to talk about your action plan. Okay, so these are the things that have been uncovered. Sometimes it's as simple as low vitamin D. I know more and more people are checking for that now, but that's one of the many things. There's a genetic type of cholesterol called lipoprotein small a that runs in families, but it's not on your standard lipid panel. So if that's a problem, we will address that. So we'll identify this individual's risk factors, common or uncommon. Maybe it is high blood pressure, one of the 20 things. And I say on average, people usually do have about 20 items, and somewhere between 10 to maybe even 20 of those are new to them. They had no idea it was going on. And we just tackle them one at a time.
So you start off with just a basic blood panel.
Yes.
And then from there, okay, we need to order this specific lipid panel, or we need to do this.
It sends us to the next step.
Sounds very, very thorough.
It is very thorough.
Yeah.
Yes. And it's very thorough in the beginning, but then, like you say, we do a few things beyond that, depending on the individual, what we find in that initial baseline.
And then if, we would all love to be able to say, medicate, if whatever we do, we can get people off all their medications, but sometimes that's just not going to happen. So if a patient does go through your program and then it is determined that they need a statin, or they need some kind of medication to help with their blood pressure, or maybe even temporarily. Do you have a cardiologist that you work with that can do that?
I do, yeah. I have cardiologists and internal medicine physicians. It's a variety depending on the situation at hand. Sometimes we need to get a vascular surgeon involved to see if one patient who did have such significant blockage in the carotid arteries that I was uncomfortable saying, we're just going to focus on prevention. Maybe you do need surgery to try to take care of that blockage. So let's get the vascular surgeon involved. And fortunately, we had a vascular surgeon that said, if the patient's willing, I'm willing to follow this along with you for 6 months to see if we can improve it before going to surgery. So anyway, it's just an example of how we pull in a variety of our colleagues as needed to take care of that patient to ensure they're protected for the rest of
What's the number one cause of death of women in the United States?
Cardiovascular disease. Yeah. It's
a lot of people don't know that.
I know. It's still a myth.
A lot of people would say breast cancer.
That's right.
But it's maybe even third.
It is the third. Yeah. Absolutely. Yeah. Yes.
So cardiovascular disease, the number one cause of death of women. We know, everybody thinks of heart attacks. They think of an overweight, middle-aged or older male.
Yeah, right.
But as we both know that there's not, cardiovascular disease doesn't choose sex or gender. It can affect all of us.
Yeah.
The beautiful thing about it, as you've heard today, is there's a way to prevent it. There's a surefire way to prevent it. But like anything else, actions need to be taken. But the actions basically are to pick up the phone and call somebody like Dr. Pritchard. We'll put her contact information at the bottom of the screen. And, Father's Day, this won't air before Father's Day because it's just in 2 days, but I'm kind of thinking this might sound really, really cheesy, but what a great gift to get your father or to get your father and your mother or yourself. Just an initial screening and a blood panel can identify something that could potentially, be your demise that can be completely prevented. So, Dr. Pritchard, I'm so honored to have you on today.
Thank you.
We're definitely going to have her back. We're going to have you back because you've got so much knowledge. And I think the more that we can get this word out to people that they don't have to just say, well, that's just the fate, the cards life handed me. It doesn't have to be that way. You can be proactive. We want all of our listeners to live a long, happy, healthy life and live a harmonious life. And there's the word harmony. So it's time for our song of the day. Dr. Pritchard has picked one of her favorite songs or a song that has some meaning to her. So let's listen to what you picked, and then you can tell the artist and what the song means to you.
Okay, thank you.
There's a couple billion people in the world and a million other places we could be, but you're here with me. Take a moment just to take it in, 'cause every high and every low led to this. I'm just so glad you exist.
That's nice. Who is that?
That's Dan and Shay. And it's a song they came out with just this last year. And I think they wrote it initially with their wives in mind, but then they have also been talking about how it also has meaning to them for their fans and their followers, especially during the isolation we've all experienced and an inability to go to concerts this last year, that they're so appreciative that their fans exist. And so I can just almost get choked up when I think about how, well, first of all, let me just say this song is important to me because it reminds me of a healthy practice that I'm sure you talk to your patients about and I talk to my patients about every day, which is living in the moment. Like being thankful for this moment, mindfulness type practice where I'm focused on what we're doing right now. I'm focused on being grateful that I have this next breath, and I'm focused on being thankful that you and your whole team is here today, helping us get what we feel is a very important message out to people listening. And I'm thankful for the listeners. So I'm thankful that you exist, that your team exists, that our listeners exist, and we want to help everyone exist for the lifespan that they have allocated to them. Like live to 100, live to 120 fully intact, mentally, from a cardiac standpoint, from a blood vessel standpoint. So that's why we're here today. So I love this song, and when it came out, I'm thinking of, yes, my loved ones, but I'm thinking of my patients, I'm thinking of my colleagues that I so enjoy working with. So I thank you for this moment.
Well, it's a pleasure. My mother lived to be 100 years and 7 months.
Wow.
Fully cognitive, just sharp as a tack, and her body just finally gave out and she was ready to go. But she died very happy with all of her family around her, and that's the way I think that life should be.
Yes.
And that's the way that it can happen with all of us if we just make the right decisions. And I'm thankful that you were on the show today.
Thank you.
And that you'll be coming back. We're going to be having Dr. Pritchard back for a part 2. And then she'll be a regular, semi-regular guest on our program. From time to time, we'll have her on here discussing different things. So Dr. Pritchard, thank you very much. This has been Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart, wishing you happiness, health, and thrive in life. So until next time, stay healthy, stay happy. Bye-bye.